There's a term that's been in the news a lot, and that is sitting being the new smoking. And I think we're all familiar with what prolonged sitting does with higher incidence of neck pain and headaches, mid-back and low back pain. But now a lot of studies are showing that sitting creates a lot more morbidity than just musculoskeletal. Some of the studies are showing that there's a higher incidence of cardiovascular disease, higher incidence of diabetes, higher incidence of even, in some studies showing breast and colon cancer. So that's where we're trying to relate these other types of diseases that we would think of with smoking is also with sitting. So it's something that we need to think about since more and more of our day is in a seated position. So typically we're sitting and we want to think about good posture, being upright, but inevitably we will be in this forward position. And that creates a strain on the neck and the mid-back and everything that we're associated with. So one of the things that we can do, and the study has shown, is that if you don't need to run a marathon, you just need to move a little bit. And if you can interrupt your sitting with just a couple of minutes of stretching a few times a day, you can offset all of those higher incidence of diseases. So you don't need to go run a marathon. But another study also showed that there's an enzyme, this LPP1 enzyme. It is something that the body utilizes to reduce inflammation, so it's going to help keep the cardiovascular system healthy and also reduces things such as blood clots, is actually turned off with sitting more longer than a couple hours. The interesting thing about the study was that it was not turned on or increased with exercise. So it was sensitive to sitting, but was not responsive to activity, which means you couldn't undo it. So if you sat all day and then you went and ran, you couldn't undo the damages that had occurred with the prolonged sitting. So it's important that we maybe sit for an hour, take a minute or two, get up, move, and then go ahead and sit back and resume what you were doing. So a couple things that you can do right at your desk. If you have a chair, recruiting the big muscles, going in and just coming into good form with the squat, doing 3 sets of 10 repetitions, turning into lunges. Again, using the balance, using the chair for balance. Other good things are going to be just coming out and doing leg abductions, leg extensions, and then you can do external rotation. So you're hitting all your hip muscles. The bigger the muscles, the more work, the better you're going to do. Just even standing extension exercises to offset our prolonged flexion will be important. Standing also burns 3 times more calories than sitting does. So if you can and you're on the phone, just stand. You're working the muscles a lot differently than if you were sitting. If you're writing or you have the ability to make a standing workstation are very popular. And then you can alternate sit from stand as tolerated. So the important thing is you don't have to move much, but you have to move some, and you have to disrupt that hour of sitting with just a couple minutes of movement. And if you do that, I think it's going to be something that you're going to pay dividends later. So if you have any problems with anything, you can always give us a call, and we'd be happy to kind of work with any of the ailments you have regarding backs, hips, shoulders that's preventing you from doing this. So if you have any problems, just give us a call.